Imagine opening your eyes to find yourself strapped with worn leather thongs to a dark, stained wooden table. The air around you is thick, impregnated with the unmistakable metallic smell of fresh blood mixed with the sweet stench of infection and the cold sweat of sheer terror. There are no bright LED lights, no softly beeping monitors, and definitely no anesthesiologist by your side holding an oxygen mask to send you peacefully to sleep. Instead, standing before you is a man in a stiff leather apron, holding a hand-sharpened bone saw and a razor-sharp scalpel. He looks at you not with sadism, but with an almost inhuman surgical coldness. Welcome to the operating room of the ancient world, where modern anesthesia was a distant science fiction dream, and the only thing separating a doctor from a butcher was the speed at which he could slice through your flesh. By today's standards, the idea of allowing someone to crack open your bones or amputate your leg while you are 100% conscious sounds like the premise of a psychiatric horror film. But for thousands of years, this was the daily reality of human medicine. Whether you lived in ancient Rome, the Middle Ages, or even the early 19th century, going to the doctor was not a guarantee of relief. It was an ultimate test of biological survival. Without effective painkillers, without antibiotics to stop sepsis, and without the slightest clue that germs even existed, the question that haunts historians and neuroscientists to this day is not just how patients survive this nightmare, but how the brains of the doctors themselves could operate amidst the chaos without going completely insane. If you place a healthy human brain in front of piercing screams for help, spurting blood, and the visible agony of another individual, your nervous system's natural reaction is sheer terror. Your prefrontal cortex triggers empathy alarms, your amygdala floods your bloodstream with cortisol and adrenaline, and your primary urge is to run as far away as possible. Yet, the first surgeons in history had to voluntarily walk into that exact scene every single day. They had to hold the blade, stare into the terrified eyes of a person begging for mercy, and coldly begin to cut. How did the brains of these professionals hack their own biology to override the natural response of empathy and shock? The answer lies in a powerful defense mechanism of the human mind known as profound emotional desensitization, or psychic compartmentalization. For a surgeon of the past to survive his own job, his brain needed to temporarily switch off the mirror neuron circuits, the brain structures responsible for making us feel the pain of others. In simple terms, the surgeon had to stop seeing the patient as a whole human being who feels pain and start seeing them as a complex mechanical problem that needed to be fixed before the blood ran out. It was a form of psychological anesthesia, applied not to the patient, but to the mind of the doctor himself. In the absence of chemicals to numb the pain, the only real anesthesia ancient doctors possessed was the clock. Time was the difference between life and death. The longer a surgery dragged on, the deeper the patient slipped into neurogenic shock from intense pain, and the more blood they lost on the table. That is why the greatest surgeons of the pre-anesthesia era were celebrated not for the delicacy of their stitches, but for their terrifying speed. Legendary doctors were capable of amputating an entire leg below the hip in under 30 seconds. Picture the scene. The doctor grabs the knife, makes a swift circular cut through the thigh, switches to the bone saw, makes 6 rapid back-and-forth passes, ties the main arteries with silk thread, and cauterizes the wound with a red-hot iron, all while the assistant's stopwatch has barely passed the 1-minute mark. This obsessive need for speed turned surgical theaters into arenas of spectacle and horror. Crowds of students and onlookers squeezed into the bleachers to watch the show. But this extreme speed exacted a tragic toll in grotesque errors. In one of history's most famous medical incidents, a British surgeon, in his eager drive to amputate a patient's leg in record time, accidentally sliced off his assistant's fingers and slashed through the coat of a noble spectator. The spectator died on the spot from a heart attack caused by sheer fright. The patient and the assistant both died days later from infected wounds. This event went down in history as the only surgery with a mind-boggling 300% mortality rate. Yet, if pain was the invisible enemy inside the operating room, what was the universal remedy for almost every other ailment of the body? The answer was simple, abundant, and terrifying: blood itself. For more than 2,000 years, Western medicine was dominated by the theory of the 4 humors, formulated in ancient Greece by Hippocrates and consolidated in Rome by Galen. It was believed that human health depended on the delicate balance of 4 bodily fluids: blood, phlegm, yellow bile, and black bile. If you fell ill with a fever, heat stroke, pneumonia, or even depression, the diagnosis was invariably the same. You had excess blood fermenting inside your body. And the only acceptable medical solution was to open a vein and let the liquid drain. The practice of bloodletting became the most widely practiced and enduring medical tool in all of human civilization. Doctors used thin scalpels called lancets, or applied dozens of hungry leeches to the patient's skin, draining pints of blood in grueling sessions. Biologically, what occurred was a disaster disguised as a cure. As the patient lost blood, their blood pressure plummeted dramatically. The high fever seemed to break, the patient's agitation subsided, and they sank into a state of extreme stupor and calm. To ancient doctors, watching the patient stop deliriously thrashing and quiet down seemed like irrefutable proof that the disease was exiting along with the blood. In reality, the patient's brain was simply entering severe hypoxia, on the verge of shutting down due to a lack of oxygen. The most fascinating aspect of this era is not merely the lack of technical knowledge, but the incredible capacity of the human mind to construct narratives that give meaning to suffering. To these doctors, bloodletting and brutal surgeries were not acts of torture. They were heroic battles against the chaos of nature. And to cope with the unimaginable mental toll of watching half their patients die of infection the following day, ancient doctors developed guilds and brotherhoods filled with rigid rituals and a peculiar dark humor. Ironic laughter and sarcastic detachment became the psychological bulletproof vest for those who lived alongside the stench of gangrene every day. Looking back through the lens of modernity, it is easy to judge these doctors as primitive or heartless. But the raw truth is that we are the direct heirs of their bloody trial and error. The biological resilience and brain plasticity of these men kept the flame of medicine alive during the darkest periods of human history. They faced trauma, darkness, and a complete lack of resources with the only tools they had at their disposal. The courage to hold the blade, a mind capable of blocking out panic, and a blind faith that, in the end, the sacrifice on the operating table was worth it. Today, when you sit comfortably in a modern clinic, smell the clean scent of antiseptic alcohol, and receive a tiny injection that completely numbs your pain in seconds, remember the anonymous warriors of the past. Remember the patients who endured the unbearable, and the doctors whose hands shook in the dark after a long day of draining blood and sawing bone. Modern medicine was not built in sterile, quiet laboratories. It was forged in noisy amphitheaters, over stained wooden surfaces, driven by the sweat, the shock, and the river of blood of those who came before us.